much of this do you think it's coronavirus and whatever's going on with U.S. and China? How much of this do you think is China saying, you know what, screw you, U.S. You're playing this hardball with me. I'm going to come and bully you in a whole different way that you won't even pay attention to it. How much credibility do you give to that? 5%? 1%?
I'm not going to answer that question, but I am going to answer the question in a different way. Because I'm Christian at heart and I like to think that nobody would want to kill people. I will say this much, and if you're listening, write it down. In late November, word had already gotten off of the mainland that there was a virus in Wuhan. On January the 15th, the U.S. trade bill was signed, phase 1. December the 15th. I had a whole month off, December the 15th. 6 weeks later, the trade truce was signed with an out clause, a very clever out clause that the Chinese made sure was in there that said if there was any kind of act of God, pandemic, then they didn't have to make good on what they had committed to buy from the United States. Within days, they announced the first coronavirus. So, did the Chinese know damn well that this thing was running around the world for 6 weeks before they shut down Wuhan? Yes, they did. Is that criminal? Yes, it is. Does it deserve to go in front of a world tribunal? Yes, it does. Because we know that it was the unfettered travel that made this thing a global phenomenon that was impossible to contain. 6 weeks they knew, but they wanted that out clause. And then they underreported what happened in Wuhan, which a toddler could tell you based on what happened in Italy, based on what's happened in Germany and in France and now in the UK with Boris Johnson in the ICU. There's no way in a city the size of New York, 11 million people, that there were so few cases. It's impossible with similar density to New York. So the World Health Organization should be held accountable for not holding China accountable to providing good, valid data so that the rest of the world could prepare for fewer people to die. And that's what you're talking about.
Winning the battle against epidemics does not lie in the hands of experts. One man who was on the front line battling Ebola in the 1970s says it's in the hands of the people who are most affected. Professor Peter Piot helped discover the Ebola virus in 1976 and was a key part in research into HIV/AIDS. CNA's Lokwe Su spoke with him in Singapore shortly after the World Health Organization finally agreed to declare the Wuhan coronavirus outbreak an international emergency. Professor Piot says it should have come earlier.
It came a bit late because already last week when the committee met at WHO, it could have declared this a public health emergency of international concern because there were already not only lots of cases in China but also in a growing number of countries, and that means that it is of international concern. But better late than never, and anyway the most important thing is that no country waited for that declaration to put in place measures to contain this epidemic.
Does that worry you that they did not wait and each one came up with its own piecemeal, potentially haphazard and possibly irrelevant measures to contain their own national concerns?
It would obviously have been much better to declare this epidemic as a public health emergency of international concern, because maybe then countries would have worked closer together to put in place similar measures. But at the end of the day, all countries have reacted, and there are slight differences, but